Why do I have a wide nose? There are a number of different reasons of why a nose can be wide. The number one reason is genetics of the way that your nose is made, maybe the way that your other family members' nose is made. They can be wider, and there are ways to make it narrower. The trauma can also make your nose wide. If you have trauma to the front of your nose, that in general makes nasal bones spread out or be wider this way. Sometimes having surgery, the nose can be made wider in a way to take down a bump, and if it's not brought in enough, it can make the nose feel wide as well. How do I get rid of a wide nose? There's a few different ways you can address a wide nose depending on what is causing that wideness of the nose. If it is the nasal bones or the parts up here that are sitting wider this way, and if the cartilages here are also sitting wider, what you can do are osteotomies. That means just small little cuts in the bones this way to bring the nose in. This is great when you have thinner skin and it's just the anatomy of the way that it sits is a little bit wider here. This is also great in noses that can have more projection this way. So you may have a bump, you may have more prominence of your nose this way, and so bringing it down this way and bringing it in could be a great way to make it more slim. If your nose is wide because you don't have that much projection this way and you feel like it's a little bit flatter whenever you look from the profile in comparison to your forehead and your cheeks, this may be something that, yes, the nasal bones may sit wider, but they also sit lower. And so in that case, we usually bring them in, but also build that area up. So you can use a lot of different things to build this up. This can be cartilage, this can be bone, this can be diced cartilage, this can be your own cartilage, this can be irradiated cartilage. This totally depends on you and your surgeon, what's going to work best to build this up and give you more of that slimmer, more defined nose. How can I make my nose slimmer? So you can do surgical and non-surgical things to make your nose look slimmer. The non-surgical way is with fillers. You can actually add to the dorsum here right in the middle, build it up this way, and so you're taking this triangle that's sitting more like a wide triangle and you're adding to the top of it, making it a slimmer triangle. So adding here can actually make the whole nose look slimmer, and if you give a little bit more projection to the tip, that can help the tip look that way as well. Surgically, this depends on why your nose is wider. You can do what we call little osteotomies to bring the nasal bones in. You can bring the rest of the cartilage of the nose in to make it physically just sit closer to the midline. Surgically, you can build that nose up as well if your nose does not have that much projection here, and giving you more projection is going to improve your profile as well as the view from the front. Can rhinoplasty make your nose less wide? Yes, absolutely. That's one of the most common things we do with rhinoplasty is take a wider nose and make it narrower, make it more refined, make it slimmer, and fit in with the other features of the face. And so that's probably one of the most common things that I do is actually make a wider nose slimmer. Have questions? I help people like you every day and would like to help you as well. Please just give us a call.